Hi, my name is Christine, and I am conducting a post-fall huddle video regarding an incident that happened earlier today around 9:20 a.m. In attendance, we have myself, June's nurse, the nursing supervisor, the charge nurse, primary nurse, the UAP, physical therapy, occupational therapy, June, and his daughter. We have meetings like this so we can assess why the patient fell and how to prevent this in the future. When a patient gets admitted to the hospital, they are assessed on a fall risk assessment, or what we call a Morse fall score. I believe, looking at this incident and speaking with June's daughter, that June's fall risk is significantly high. Based on this scale, I calculated actually 90. Um, the history of falls at the time of admission was 0. Secondary diagnosis is 15. He has UTI and pulmonary hypertension, and he does have dementia. Ambulatory aid, he has a walker and he uses furniture. He coasts from furniture at home because sometimes he forgets to use the walker. At home, he doesn't have an IV, obviously, but here he does, so that gives him another 20 points. His gait, it's weak at best. And the mental status is 15 because he overestimates and forgets his limits based on the dementia. So what had happened earlier today was around 9 a.m. June needed to use the bathroom, and June's daughter pressed the call bell for him. She learned this upon admission of how to use the call bell and how to help her father. So they waited about 15 minutes, and no one had come into the room. So June's daughter attempted to assist June to the bathroom, and this is when June tripped on some tubing. And at that point, he suffered a fall, and the primary nurse and UAP heard the calls for help, and they came in to assist June and the daughter. June has a right hip fracture and is now awaiting ortho consult. He has a new medication for pain. What can we do to correct this for the future? What we can do to correct this for June and all of our future patients is to make sure that all of the rooms are clear, the pathways are clear, check for obstacles to the bathroom, make sure there's no tubing on the floor, make sure that the furniture is adequately away so people with walkers and canes can get through easily without tripping on anything, without getting caught up on anything. And even if you have to go through with the walker and push it through, and to make sure that you can easily go through without bumping into anything, just for safety. And what I would advocate for June is to actually have a bed alarm, just in case his daughter is not sitting right next to him. He actually fell with his daughter right with him. So I would definitely advocate for a bed alarm, so that would alert the nurses to come when they heard that, and have a bedside commode nearby, a urinal, and a bedpan, just in case he was not able to get up to use the bathroom, or if it was in the middle of the night. To have a night light at night, non-slip socks, which we have for everybody really when they come into the hospital. To have PT and OT reevaluate and get some help with the walker and out of the bed evaluation to see if he can even do that at this point right now with the fracture. And always to make sure the call bell is nearby. have the fall risk bracelet on and make sure that's always there, and verbalize to the staff and document that they should be checking in on him more often. And from this point forward, the team and I will have a safety risk assessment and room check on all the patients going forward, and update this in our protocol, as far as make sure the furniture is, a safe distance away for folks that have walkers and wheelchairs, and so we hopefully avoid any future falls in the future. If anyone has any questions, please feel free to speak up. If not, or you think of anything later, you can certainly email me and the team, or call the floor. I appreciate everyone being here. And June, and your daughter, if I will definitely be seeing you guys. And if you have any questions, you certainly can ask me or anyone that comes into the room, and we will certainly help you as best as we can. Thank you so much for coming. Take care, guys.